don't get carried away by those, because there is a problem, there is a solution. Sometimes the solutions are created so that the problems can be addressed, even if they are not problems. Even the phone,
and tablet and all of that.
they're good enough to be bad. So the only logic is that आपके बच्चे के स्कूल का जो वेट है बैग का, वो सिर्फ 10-20% होना चाहिए बच्चे के वेट का. Simple, fair and square. कुछ इसमें डिस्कशन नहीं है.
This is actually a good moment to say that बच्चों में medicines don't act the same way जैसे
Yeah,
बड़ों में होते
right.
हैं. So when we talk about tablets,
Yeah.
strict no for
Yeah,
kids.
absolutely.
बच्चों को नहीं देनी है.
Pediatricians on your podcast saying that even 0.1 ml of extra drug can be dangerous to it. How do you get rid of it? Of course, saying that it is not a problem doesn't solve the problem.
Yeah.
Because the child is not. But बच्चा जितना गिरेगा उतनी जल्दी चलना सीखेगा.
क्या walkers negatively impact करते हैं बच्चे की growth? आज चाहे बच्चे हों या बड़े, जेनजी हो या हम और आप, प्रेगनेंसी से लेकर पेरेंटिंग तक किसी ना किसी स्टेज पर ऑर्थोपेडिक प्रॉब्लम्स ऑलमोस्ट हर घर का हिस्सा बन चुकी हैं. कभी बैक पेन, कभी नी पेन, कभी पोस्चर इश्यूज और कभी बच्चों के ग्रोथ से जुड़े बहुत सारे सवाल. इसीलिए आज के इस पॉडकास्ट में हम लेकर आए हैं गूगल के 25 मोस्ट सर्च ऑर्थोपेडिक क्वेश्चंस. वो सवाल जो लोग रोज सर्च करते हैं लेकिन उनके क्लियर आंसर्स मिलना मुश्किल होता है. मैं हूं डॉक्टर गौरव निगम और आज हमारे साथ मौजूद हैं देश के वन ऑफ द बेस्ट ऑर्थोपेडिक एक्सपर्ट्स में से एक, डॉक्टर युगल कारखुर. तो अगर आप अपनी हेल्थ, अपने बच्चों के पोस्चर या फ्यूचर मोबिलिटी को लेकर सीरियस हैं, ये एपिसोड आपके लिए है. चलिए शुरू करते हैं. So finally, welcome Yugal.
Thank you.
We know each other like since I don't know. Now it's been 20 years almost, है ना? And पहली बार हम ऐसे formal setting में बैठे हैं. We've been to the same medical school and great. यार मेरा जो idea था, wanted to bring an orthopedician to the show. So many times we neglect such basic things. And जिसके consequences बहुत भारी हो जाता है जाके, right? I want to start with the basic. मैं इसको 3 parts में cover करना चाहता हूँ. I want to start with the pregnancy, then of course your childhood part where we start with toddler and go till teens,
Yeah.
and of course इन सबको सही रखने के लिए healthier parents, healthy moms and dads. I'll start with the बच्चा वाला part first. When I was going through, when I became a father, ये W sitting was like a very big question.
Yeah.
और वो होता है, बच्चा ना अपने आप W करके बैठने भी लगता है. तो अवॉइड कराना चाहिए या नहीं कराना चाहिए? And if you can tell a little bit what exactly is this W sitting?
Right. So first of all, thank you so much for the invitation. And we know each other for a long time.
Yeah.
And the idea of when you said that I should be here, it made sense to me because most of the parents or whenever you want to seek knowledge from internet, the main problem which I have seen is that the knowledge is too technical in nature. So there is still a gap. There is a knowledge, but it doesn't make sense to the person who's seeking it because you cannot get anything out of it. It is too technical. That is probably what happens when I see patients in my OPD. If I'm not able to explain them the disease in the language they want to understand, it'll end up in a miscommunication most of the times, right? And that's why it makes a lot of sense of what we are talking today. Coming to the question part, the W position, most of the parents, they will either send me pictures, videos of their kids growing up when they have started sitting. They say they generally sit in a W position with their legs folded backwards. Is it good, bad? Is it something which is normal, abnormal? Let's understand a bit of how the body works. So when the child is growing, the hip joint is in a particular position. The hip joint, which in medical term is called as anteversion, which means that the hip is slightly in front, which makes it easy for the child to sit in W position. Can you do it at your age? Of course not, because as we develop in our age and as the child develops into 14 years, 15 years, 16 years, that angle of hip, the anteversion, will slowly correct itself. Once that correction happens, you'll not be able to do it. So the point of whether it's good or bad is a different thing altogether. Whether you're able to do it or not do it is the point. So the child will be able to do it, and that is why the child does it. Should you stop the child from doing it? Of course not. There's no need to do it. That is how the typical growth pattern of the child is. Some will have a flexibility more than the other, and they'll be able to do it more frequently. But is it a bad thing? Is it going to negatively impact the growth? Of course not. So it's a pure myth.
I clearly remember this, and it's a strong myth.
Yes.
You know what? Being a pediatrician myself, so you get these glimpses of information from here and there, and a lot of medical professionals do recommend कि नहीं आप मना कर दो बच्चे को, let them not sit like this, let it not become a habit.
Right.
But you were saying that
So if there's because it's a structural change, which is the growth part, and it is going to change, you're doing something or not doing something is not going to impact. But I'll put a caveat to it. The caveat is that if the child continues to do that, even after the age of 14 years, 15 years, then there is something which is now structurally established, which means that the hip will remain in that position. Right? So some children have a high anteversion, means the hip angle is more than the normal.
ठीक है.
So those could be a problem when the child grows into adolescent and adult.
Right.
Those are very few subset of patients. Less than 1% of the children will have it. But that doesn't mean that every child should, and your prevention is not going to change it.
But क्या ये जो 1% बच्चे आप बोल रहे हो, do you think it happened because of the?
No, absolutely not. That is how the body was designed. The genetics was such. इसलिए वो वैसा हो गया. आपके कुछ करने या ना करने से
कुछ फर्क.
So please leave your child alone. Let him or her sit the way she wants.
And you know what? I mean, just personally, they look really cute in this scenario.
Yeah. So you should rather click pictures and
Absolutely.
post on Instagram than getting worried about it.
Then another very important thing is walkers.
Yeah.
When we were kids, walkers were everywhere.
Yeah.
ठीक है. Well, I clearly remember. अब पता है मुझे क्यों याद है क्योंकि obviously उस एज का तो याद नहीं होगा when I was like that old, but probably walker must be lying around at my house even when I was a little grown up. But it was a red color walker with the 2 holes where you put your legs in.
Right.
So it was a rampant.
Right.
ठीक है. हर घर में एक walker तो होता है अगर बच्चा है तो.
Absolutely.
I don't see them now so much, but my question is very direct. Like, क्या walkers negatively impact करते हैं बच्चे की growth?
Correct. So exactly as your childhood was, I come from a small part of the country. So we used to have the lakdi wale walkers. So they used to put us in between that lakdi wale walkers.
Okay.
Do they really help? Yes, it helps the mother. She can do her work at home. आपने बच्चे को उसके अंदर डाल दिया, बच्चा गिरेगा नहीं, भागते रहेगा उसके साथ, टकराएगा तो चोट नहीं लगेगी. That was the whole thing. And we have to understand it from the mother's point of view. माँ के पास हेल्प नहीं होती थी, सारा घर का काम करना पड़ता था, किचन का भी काम करना है, झाड़ू पोछा भी करना है और बच्चे का ध्यान भी रखना है.
सही बात.
Father used to be out working. So we should not say that it was a neglect, but of course it was the lack of knowledge. When the child or toddler is growing up, चलना शुरू करता है, वॉक करने लगता है, वॉक करेगा तो गिरेगा, because now the brain is starting to learn of how to balance the muscles. When that balancing act happens, walking is a part of it. बच्चा जब चलेगा तभी मसल सेंस करेंगी, तभी वो वॉक का गेट का पैटर्न फिक्स होगा. If you're putting the child inside a walker or something which moves on its own, वो मसल्स का फंक्शन वो वॉकर कर रहा होगा, which is quite abnormal in a way. And that is the reason why with the advent of education and now mothers have helped, the family support has got better and the fathers have become more cooperative in bringing up the child. So that's why they are going out. But from the science point of view, from the orthopedics point of view, from growth development point of view, of course they were never good. This was just a arrangement which was done just so that the mother can be free most of the time and she can do her work. But yeah, the straightforward answer is that absolutely not. वॉकर बिल्कुल इस्तेमाल नहीं करना चाहिए, बच्चे को गिरने देना चाहिए. ऑफ कोर्स एक सेफ एनवायरनमेंट आप क्रिएट करके रखो ताकि उसे चोट ना लगे, बट बच्चा जितना गिरेगा उतनी जल्दी चलना सीखेगा.
That's very well put. And the reality of life भी है ना.
That's how the whole life for us, And the faster you learn, earlier you learn.
Right. In fact, हम just अभी बात ही कर रहे थे just before the show, right? I said, what does really kill you makes you stronger. Exactly. So true, right?
But don't make the environment safe around the child.
Yeah. I mean, that's the best as a parent आप कर सकते हो, है ना?
Yeah, correct.
You know, another very important question, which also I used to get a lot when, when I was practicing in the OPD. Toe walking.
Yeah.
और दिखता भी बहुत है.
Correct.
तो ये जो बच्चे हैं जो अपने टो पे वॉक कर
They love doing it. Yes, yeah, they love doing it.
ये नॉर्मल है या नहीं है फर्स्ट ऑफ ऑल एंड अगर ये मतलब एंड व्हाट आर द कॉन्सिक्वेंसेस ऑफ
Right. So बहुत simple और बहुत clear message should go to the audience you are addressing. Toe walking can be normal and abnormal both. So toe walking can happen because of muscle imbalances. खास करके वो बच्चे जिनको सेरेब्रल पाल्सी की दिक्कत है. तो अगर आपके बच्चे को इस चीज़ की डायग्नोसिस हो गई है या बच्चा चलना शुरू करता है और सिर्फ टोज पे ही चलता रहता है हमेशा, उसको आप अगर नॉर्मल पैर रख के चलने के लिए बोलेंगे तो बिल्कुल नहीं चलेगा, तो वो एक रेड फ्लैग है. तो आपको अपने पीडियाट्रिशियन या ऑर्थोपेडिशियन से ज़रूर मिलना है कि आप कहीं पे कोई सटल साइन ऑफ सेरेब्रल पाल्सी मिस तो नहीं कर रहे. लेकिन मेजॉरिटी ऑफ पॉपुलेशन में बच्चे टो वॉक करते हैं बिकॉज उनकी वन ग्रुप ऑफ मसल पहले ज़्यादा स्ट्रांग हो जाती है, सो दे एंजॉय डूइंग इट. दैट्स अबाउट इट. इट्स अ प्योरली physiological phenomena and it will resolve as the muscle balances correct themselves. So ये purely physiological है. बट अगर आपको अगेन रेड फ्लैग ये है कि अगर ये रेगुलरली कर रहा है बच्चा, आपने उसे कभी नोटिस नहीं किया चलने के बाद कि वो पूरा पैर जमीन पर रख के चल रहा है, तो वो एक रेड फ्लैग साइन हो सकता है. यू हैव टू सीक हेल्प, क्योंकि वो सटल साइन हो सकते हैं मसल इम्बैलेंसेस की किसी बीमारी के, खास करके सेरेब्रल पाल्सी को क्योंकि हम ज़्यादा जानते हैं, तो वो एक प्रॉब्लम हो सकती है. बट अदरवाइज टो वॉकिंग इज नॉर्मल एंड उसका कोई फ्यूचर ग्रोथ में इम्पैक्ट नहीं होगा.
बट इन योर क्लिनिकल प्रैक्टिस आई नो मतलब मोस्टली सच केसेस आर नॉट गोइंग टू ऑर्थोपेडिशियन, बट कितना है मतलब मोस्टली इज इट 90 कैन आई से 99% ये फिजियोलॉजिकल वाला ही है?
Most of that, yeah, because the risk of it being a cerebral palsy is as much as the risk of cerebral palsy in overall population.
Yeah.
So you can just make
And
sense.
also I feel there are so many other elements of diagnosis जब cerebral palsy
Exactly.
this is just a
और बहुत सारे elements आप रहे होते हैं, but then to the parents it's always a good thing that you seek help. Every time a parent come to me with these queries, I give time to them, talk to them, and I really praise them. आप बहुत अच्छा किया आप आए. आपके दिमाग से एक डाउट अब क्लियर हो गई है. बिकॉज अदरवाइज अगर उनकी डाउट क्लियर नहीं होगी तो वो फिर बाकी के एवेन्यूज एक्सप्लोर करने लगते हैं अपनी डाउट क्लियर करने के लिए, पड़ोसियों से, आपके पेरेंट्स से, इंटरनेट पे जाके इन्फॉर्मेशन ढूंढने लगते हैं, एंड वो और कंफ्यूजिंग होती है. तो बेटर है आपने हेल्प ले ली, आपने पूछ लिया और वो डाउट हमेशा के लिए क्लियर.
मतलब मैं एक बार बहुत इसको सिंप्लीफाई करना चाहता हूँ. अगर बच्चा टो वॉक कर रहा है एंड रेगुलरली कर रहा है, ठीक है, आफ्टर ही लर्न्स वॉकिंग, बट ऑन आस्किंग, यू नो अनदर वेरी इंपॉर्टेंट क्वेश्चन, और ना इनफैक्ट मेरे इस टाइम पे जितने भी बिहाइंड द कैमरा लोग हैं, यू नो वी ऑल हैव चिल्ड्रन लाइक इन दैट एज ग्रुप, ठीक है, एंड आई थिंक इट विल हेल्प देम आल्सो एंड इट विल हेल्प द ऑडियंस. बहुत कॉमन इशू, रात को बच्चा सो गया, एंड ट्रूथ बी टोल्ड अ लॉट ऑफ इंडियन हाउस होल्ड्स, आई वुड से 99% बच्चे को साथ ही सुलाना है, ठीक है. व्हेन आई बिकेम अ फादर आई रिमेंबर नहीं कॉट ले लो और बच्चे को यू नो स्टार्टिंग से सॉडल करके आपको ले करते भी थे, फोटो भी खींचते थे,
राइट.
फिर रात यार मैं अपने साथ ही ले लूँ. सो आई एम नॉट रिकमेंडिंग को स्लीपिंग राइट नाउ, बट आई एम जस्ट टेलिंग व्हाट द सिनेरियो इज. नाउ माय क्वेश्चन इज दैट बच्चा थोड़ा बड़ा होता है, टॉडलर उसमें जाता है, या थोड़ा बड़ा होता है, रात को उठता है, बहुत तेज़ पैरों में दर्द हो रहा है, या inability to induce the sleep because of कि पैरों में दर्द हो रहा है, very common. We call them growing pains. So what are growing pains? Are they dangerous, not dangerous? और treatment है क्या कुछ?
Right. So let's split this question into two, and I'll try to answer the first one first. As far as the courts are concerned, it's about the kind of culture we have brought in. तो हमारे भारत में जो कल्चर है वहाँ पे हमारे घर बहुत बड़े नहीं होते थे ट्रेडिशनली. घर छोटे होते थे, कमरे कम होते थे, एक जॉइंट फैमिली में रहते थे जहाँ पे माता पिता का एक कमरा है, पेरेंट्स का एक कमरा है। वहाँ पे ये स्कोप क्रिएट करना कि आप बच्चे को एक अलग से कमरा बहुत जल्दी इन लाइफ दे सकते हो, वो ऑलमोस्ट इम्प्रैक्टिकल होता था।
राइट।
एंड वहाँ से वो कॉन्सेप्ट आया कि बच्चा आपके साथ सोएगा। और एक और लॉजिक है कि रूम साइज बहुत छोटे होते थे, तो उस कमरे में बिस्तर के अलावा, आपकी अलमारी के अलावा अगर आपने कॉट भी लगा ली तो आपने चलने की जगह खत्म कर दी, और ये आज भी ट्रू है।
यस।
दीज आर द प्रैक्टिकल रीजन ऑफ व्हाई इट वाज नेवर देयर। ये वहां से नहीं है कि मैं मेरे बच्चे को दूर रखूंगा तो कम प्यार करूंगा। वेस्टर्न वर्ल्ड में लोग प्यार भी करते हैं और दूर भी रखते हैं, सो दैट्स नॉट द पॉइंट। So it is from the logistic point.
This is really nice.
Yeah.
I mean, this aspect
Yeah,
was
that is where it has come from. From our culture evolves from our things which we have, the resources.
absolutely.
So वो problem रही, and इसलिए but as the parenting is growing and modern parenting का जो आप discuss कर रहे थे point था कि we have started understanding that putting the child in the cot is good for child.
Yeah.
It saves child from many
A lot of
complications. Which are,
yes.
Keeping the child on bed between the parents is discomforting both for the child and the parents.
And also putting kid at a little more risk than otherwise.
And you would know that better. So yes, I too feel that, and as a new parent, I also feel that. I mean, that's a good idea. You should not buy cord just for the photography point.
Yeah.
You should actually use it. And coming to the next part, the growth pains generally starts when the child start moving around.
Yeah.
So when the child crawls and then starts walking is when the growth pains will come. फंडा बहुत सिंपल है, ग्रोथ बड़ी फास्ट हो रही है. सो आफ्टर 16 ईयर्स ऑफ एज आपकी हाइट भी उतनी है, आपका मसल बल्क भी उतना ही है टिल दी एज ऑफ से 40 ईयर्स. बट जब बच्चा बड़ा हो रहा होता है, पैदा होने से 14 साल तक हर महीने ग्रोथ हो रही होती है एंड ए सुपर फास्ट पेस. बच्चा हर महीने अपना वेट डबल कर रहा होता है, एटलीस्ट इन द फर्स्ट 1 ईयर. सो मसल्स कैचअप नहीं कर पा रही हैं उस ग्रोथ से.
Right.
And that reduces the blood flow to the muscles. Muscles are trying to grow, meet up with the requirement, is why the growth pain happens, which are purely, absolutely normal. They're absolutely fine. There's nothing wrong with the things you're doing, or it is not something which is suggestive of a disease. Of course not. But how do you get rid of it? Of course, saying that it is not a problem doesn't solve the problem, because the child is not sleeping in night.
Absolutely.
A good oil massage before the child goes to the bed, जो हमारी ट्रेडिशनल भारत की प्रैक्टिस में बड़ा कॉमन था. साइंस कहती है कि मसाज का कोई साइंटिफिक रोल नहीं है, बट मुझे ऐसा नहीं लगता. इफ़ यू मेक द चाइल्ड गो थ्रू मसाज एट से 7-8 इन द इवनिंग, जब वो सोने वाला उसके 1-2 घंटे पहले, इट जस्ट सूट्स द मसल. चाइल्ड वन गेट्स ए पैटर्न कि मेरी मसाज होगी, उसके बाद मुझे दूध मिलेगा, फिर मैं सो जाऊंगा. सो द चाइल्ड अंडरस्टैंड्स ए पैटर्न कि अब होने का टाइम हो गया. Number 2 is that it suits the muscle. Yeah. Number 3 is that if the mother does it or the father does it, that's the best case scenario. Yeah. Because then वो बच्चे को touch मिलता है अपने parents का, वो warmth मिलता है. So it does help. Massages do help. Of course, the environment in which the child is sleeping, the room should be warm, the light should be absolutely less. ये सब चीज़ें भी इनको कम करने में help कर सकती हैं. Not say reduce करके ख़त्म कर देंगे, but because it is physiological, because ये eventually चला जाएगा, तो you should not be worried too much.
होता क्या है कि when it comes to first hand experience of that, you see your child distressed, ठीक है, वो रो रहा है, बहुत ज़्यादा रो रहा है, and I mean, I didn't really understand until I went through the similar phase जब when my daughter was crying because of those pains. तो बहुत बारी ना रात को फ़ोन आते थे, and then my assistant would call me, सर बहुत बारी फ़ोन आ गया, क्या करना है? They're asking, can they give medicine for this?
Yeah.
Can they give medicine for it?
So pacification is the treatment. So pacification को हिंदी में शांत करना कहते हैं. There's no other Hindi word for pacification.
Yeah.
It means that आपको बच्चे को calm और soothe करना है. Again, हमारी जो upbringing है उसमें हमें लगता है soothe करने का बेस्ट तरीका दूध पिला दो, right? Feed कर दो, but वो तो fed था already, आपने 2 घंटे पहले पिलाया था. What else can you do? You can take the child in your lap, you can rock the child, move around with the child. Try to make the environment conducive, more conducive if it is not. White noise बहुत यूज़ होती है to make the child sleep. रूम का अंधेरा ठीक होना चाहिए, शोर नहीं होना चाहिए. That will calm down the mind to some extent. उसके बावजूद अगर आपको लग रहा है कि बच्चे को बिल्कुल नींद नहीं आ रही है, तो and you are a better person to tell about those things कि पैरासिटामोल के सिरप्स या दे सकते हैं, बट कितना रोल है टेक्निकली, आई हैव माय डाउट.
I mean, I just feel this कि there are some bad days.
Yeah.
ठीक है, आप कर ही नहीं पा रहे हो माँ.
Yes, yes.
And maybe you are a bad day as well. as a parent.
Yeah.
And those are the days when I think elevating that pain through medicine.
Yes, yes.
Okay.
It's a good bargain. Yeah, I mean, I don't think it's wrong. Yes, you can do that. I mean, do not live in the guilt that you are not doing enough for.
वही वो parental guilt तो नहीं आना चाहिए. And definitely medicine if you're taking, please. But please your advice.
Yeah, do not
of your pediatrician.
Yeah, I mean, I've heard pediatricians on your podcast saying that even 0.1 ml of extra drug can be dangerous to a child.
Yes, yes.
So be very careful about it.
Yeah.
He or she cannot tolerate half paracetamol tablet or full paracetamol tablet like you use. You can take a half or one depending on your kind of headache. Don't do this with a child. You take a pediatrician advice.
This is actually a good moment to say that बच्चों में medicines don't act the same way जैसे बड़ों में होते हैं. So when we talk about tablets, strict no for kids.
Absolutely.
बच्चों को नहीं देनी है. बच्चों को कुछ भी देना है ना, which is related to medicine, please अपने pediatrician, अपने doctor को consult.
बिल्कुल.
That's a disclaimer that we always give. Another very important question is screens. And obviously, I don't want to ask you कि यार screen से detox कैसे करना है, या करना है, because that's really.
I think that is something we have to learn.
Yeah, I guess so first, है ना? Set by an example. But इससे फर्क क्या पड़ रहा है? From orthopedic point of view, बच्चे if they are watching too much of screens, like I don't know whether I'm not talking really about the TV, but I'm
even the phone,
phone and tablet and all of that.
They're good enough to be bad.
Yeah, and I think they're worse rather. Because the accessibility. Yeah. So इससे क्या फर्क पड़ सकता है from orthopedic?
I think I'll only talk about the orthopedic part, because there is psychological part of it, and then the growth part. From the orthopedic point of view, so my childhood, I was majority of time was in a village and then went to a smaller city. We used to play a lot, and our mother literally has to grab us and bring us home 6-7 बजने के बाद, because then it used to get dangerous.
I think 90s के बच्चे.
Yeah. So, and खेलना क्या था? खेलना भागना था, right? We did not have resource जहाँ पे क्रिकेट के लिए फील्ड है, फुटबॉल खेलने के लिए फील्ड है, वो सब नहीं था. And funny thing बताऊंगा, and I'm sure most of the kids from 90s will relate, कि वो जो ब्रिक्स होती थी जैसे घर बनते हैं, उन ब्रिक्स से गाड़ियां चलाते थे हम. बिल्कुल. एक के पीछे दूसरा, दूसरे के पीछे तीसरा, और वो उंगलियां बीच में दब जाती थी, और कुछ बहुत crazy used to do. But in doing that, we used to crawl, we used to jump, we used to do everything, and वो 1-2 घंटे was intense energy workout था. वो बिल्कुल calorie burn करता था. We used to rush home and then eat everything which was given to us. Now, if that is replaced by for a toddler with a screen of a phone, to a slightly grown-up child with a video game or a console, I mean, you see that 3 hours that brain is working, those muscles are not. That brain is working on intense amount of stimulus which cannot be replaced with anything else. Your muscles are not working. You're sitting idle at one place. Can you imagine the growth that child will have? The muscle strength. And then after 30 years, we're saying that ab jodo mein dard jaldi shuru ho gaye. It's about how it began, right? So I understand in an urban population, it is very difficult to get the child out, and because of the resource which are not around. But keeping the child in house, he sitting in front of screen for 2-3 hours, I think that's the worst you can do to your child. I mean, unfortunately, that's the truth of it. I mean, you have to make sure that your child plays.
Yeah.
So.
Actually, but two things actually. मैंने यहाँ पे लिखा था जब आप पिछले आंसर पे थे ना about massage.
Yeah.
और किस तरह science is not really proving. Actually, there's a very big meta-analysis that happened on a lot of studies across the world, which clearly showed that massage is helpful in especially the younger, that. So yes, I mean to all the parents, do massage.
Yeah, do massage and try to do it yourself.
Yeah, and to be honest, there is just no one correct way of doing it.
Yeah.
आप करो बस, just make sure your child.
I think it's just about body touch. I mean,
Body touch.
hardly has to do anything by
Exactly.
how much forces you're
और
using.
कौन सा तेल use
Yeah, or
ये और
hardly matters. I mean, use a oil which is of course
And I know
not
parental instinct is a very important instinct. आपको पता चल जाता है बच्चा क्या चीज like कर रहा है,
Absolutely.
क्या नहीं कर रहा है. Another thing that I wanted to discuss was, when you said urban areas are resources. Yeah, as I grew up here very much in Delhi,
Yeah.
and in 90s, मैं अगर अपनी locality को सोचूं, it's exactly the same what it used to be in 90s.
Yes.
ठीक है, और हम तो जाते थे बाहर खेलने.
Correct.
आज भी वही पार्क है सामने, आज भी वही चीजें. So I feel resources are there.
Yeah, I mean the
मुझे intention का problem लगती है.
it's a very easy thing to do.
Yeah.
Giving a phone is the most easy
think so,
thing,
yeah.
So, it solves your problem immediately.
Seriously. Another thing I wanted to discuss, Yugal, was heavy bags.
Yeah.
क्या है मतलब ये बस्ते तो भारी हो गए हैं.
I know.
तो what is it?
I think this I mean the government is doing a lot about schools are doing it. Like, you run one yourself, you would know that better. स्कूल के बैग्स का वेट इन प्रोपोर्शन टू द चाइल्ड वेट नहीं है तो यू आर ओनली ब्रेकिंग द शोल्डर. आप बस बच्चे का नुकसान कर रहे हैं.
Long consequences.
एब्सोल्युटली. अगर सो द ओनली लॉजिक इज दैट आपके बच्चे के स्कूल का जो वेट है बैग का वो सिर्फ 10 to 20% होना चाहिए बच्चे के वेट का. सिंपल, फेयर एंड स्क्वायर. कुछ इसमें डिस्कशन नहीं.
5 साल में बच्चा रफली अराउंड 15 से 18 किलो मान लेते हैं.
हाँ,
तो 18
किलो का बच्चे
3 किलो से ज़्यादा लाग
के ऊपर नहीं होना चाहिए. आप उसको 5 किलो का बस्ता लेके भेजोगे तो द चाइल्ड विल कम बैक विद बैक पेन्स, शोल्डर पेन्स. Over the period of time, what will happen is that the posture will start changing, right? So the spine was developed, and when we started walking on 2 feet in our evolution, spine was supposed to be straight so that we can run straight, walk straight. Putting weight on the shoulder is going to change the posture, and उसका impact आपको immediately नहीं दिखेगा. वो जैसे जैसे बच्चा बड़ा होता जाएगा और जब उस स्टेज पे पहुंच जाएगा जब कंप्लीटली डेवलप हो चुका होगा 16, 17, 18 साल के बाद, उसका इम्पैक्ट आपको तब दिखना शुरू होगा. राइट. सो जो आप आज करने वाले हैं उसका इम्पैक्ट आपको 20 साल बाद दिखेगा, बट उसको फिक्स आपको आज ही करना है. सो एज पेरेंट्स, एज people who run institutes, as government, as state, we have to understand that. And it is just about fixing the logistics. आपको 5 kgs के बैग को 3 kg या 2 kg करने के लिए बस अपने लॉजिस्टिक्स स्कूल में फिक्स करना है. आपको इंश्योर करना है कि बच्चा सिर्फ वही किताबें लेके आए या वही कॉपियाँ लेके आए जो उस दिन यूज़ होने वाली हैं.
बिल्कुल.
क्या हम फिक्स कर सकते हैं? आई एम श्योर लॉजिस्टिक्स की प्रॉब्लम हर जगह. आप स्कूल में नहीं रख सकते सारी बुक्स, बच्चों को लॉकर्स ऑफर नहीं कर सकते, बट क्या आप एक ऐसा टाइम टेबल डिज़ाइन कर सकते हैं? एंड इट्स जस्ट अबाउट फिक्सिंग दी लॉजिस्टिक्स, राइट. अगर आप बच्चे को उन दिन के जितने भी पीरियड्स हैं या जितनी भी क्लासेस हैं उनको लॉजिस्टिकली ऐसे डिज़ाइन कर सकते हैं कि बच्चा मिनिमम कॉपीज कैरी करे. इफ यू आर एबल टू डू दैट, that starts from the school. I think it's not from the institute, goes to the parent and then goes to the child. The beneficiary is the child, but then the stakeholders have to do something about it.
That makes so much of sense actually. Like back in the time when we were in school, you won't believe it, but we used to have lockers.
All right.
We went reverse now.
Right.
Lockers almost obsolete हो रहे हैं यहाँ से. And anyway, so another very important question that people come across, and the setup for today's podcast questions were the most Googled questions.
Yes.
Okay, that we tried. Another thing was the flat foot.
Yeah.
And बच्चों में
Interesting.
तो एक तो कितना देखने को मिलता है आपको, and what should be done about it?
Yes.
Diagnose parent कैसे diagnose?
Absolutely. Actually, parents, flat feet is one of the most easy condition to diagnose, even for a layman, because you know how a normal foot looks like, and you can always compare with the abnormal one. Abnormal is not the right word. I'll correct myself.
Yeah.
It's not abnormal. It's
Just
a variation of normal.
Yeah.
So, and with flat feet, the most interesting thing is that you are having it, and that's why your child is having it. It has a very strong genetic connection with your parents.
Oh, okay.
One of your parent will have it,
Oh.
like in most of the cases.
Okay.
So that should be really.
Basically, the arches.
Yeah,
flattened.
the inner arch of the foot, the medial arch, it's flattened or is not formed completely.
Yeah.
But as a child, and when do you notice is when the child start walking. Is then when you actually get to know whether the arch is flat or not. Because in a child who's not walking, before that age, every arch is flat. The arch will start only forming when the child start walking. Now these arches can be of different height, and it can be flat in few, very high in others. Majority of them are normal.
Yeah.
Majority of them will either resolve or remain so, but will not have any functional disability or limitation to the child.
Okay.
इसीलिए problem is to when you start over treating it as a parent or as a doctor, both. Now there are some market forces which will ensure that you do that, and I think the whole purpose of this podcast is that.
Yeah.
Don't get carried away by those, because there is a problem, there is a solution. Sometimes the solutions are created so that the problems can be addressed, even if they are not problems.
So well put.
So the arches are there in the market, and they're left, right, and center, available everywhere. You can buy a middle arch. The shoes business work that way.
Yeah.
Every flat feet needs to be corrected. Does it really has to be? No, absolutely not. It is only after the age of skeletal maturity, that is after 16 years, if it is really bothering, or it is of that grade where it needs to be corrected. In children also, flat feet can be part of a complex foot deformity where it needs to be addressed.
Yeah.
Again, as I started in the podcast saying that अगर आपको डाउट है तो आप आके पूछ लो
बेस्ट है
बिफोर ट्रीटमेंट करने से. मैं कई बार अपनी ओपीडी में उन पेरेंट्स से मिला हूं जिन्होंने पिछले 2 साल से बच्चों के पैरों को बांधा हुआ है डिफरेंट टाइप ऑफ ऑर्थोटिक्स और प्रोस्थेटिक्स में, जो उन्होंने किसी से एडवाइस पे बनाए थे. इट्स कम्बरसम, बहुत बच्चे के लिए इमोशनली बहुत तकलीफ देने वाला है. उसको डे 1 से लगने लगता है उसे कोई बीमारी है, और जब वो हमारे पास आते हैं हम बोलते हैं पहले ये हटाओ आप, और बच्चे से दोबारा अब इस बारे में बात नहीं करेंगे. इट्स सच ए लिबरेटिंग थिंग कि भाई ये फ्लैट फीट नॉर्मल है. आई आस्क द पेरेंट्स, आप पहले शूज निकालिए और खड़े हो जाइए ग्राउंड में, एंड आई से कंपेयर देम. They all look the same. They're like, oh, I also had it.
Shit.
I am 35 now. I don't have a problem. Exactly. You will also not. Your child will also not have any problem. So screening is important.
That's a liberating finding.
Yeah. And then they go home. Like the
aha moment.
Most of them will throw their orthotics in the dustbin I have in my room. So, so it's a good thing. I mean, to get screened. But it's a bad thing to start treatment without consultation.
Okay. यार मुझे पता नहीं है एग्जैक्टली, बट अ लॉट ऑफ दीज प्रोफेशनल कोर्सेज या फिर जो मतलब डिफरेंट लाइक फोर्सेज होती हैं और इन सब में, क्या इसमें फ्लैट फीट का?
Yes, absolutely. So more than flat feet, they are concerned about the disabilities it can cause.
अच्छा.
So it's not just about, so there are guidelines of how you get hired into Air Force or into Army or into the Allied Forces. They have very fixed guidelines, and these guidelines are not made by people who are not from medical background.
Okay.
The people who are from the medical background, the medical board sits and decides. Of course, there are laid down criteria of who can be selected and who cannot be. But does it mean that a person who is having flat feet cannot go into forces? Absolutely wrong.
अच्छा.
Absolutely wrong.
That's such a myth buster.
Yeah.
ये question comes out of also personal experience. So when my daughter was really small, like she was, sort of a toddlerish, she would just come. और ये मैं ऐसे आवाज़ करता था, making sounds out of my fingers, how we snap it. So आती थी and she would love that. ठीक है. Then she would also try, कुछ होता नहीं था. Then one day it happened. ठीक है, like when she grew up and all. एक तो ये होती क्यों है?
Yeah.
I mean, yeah, just sort of as a fun fact.
Yes.
And I've seen people doing that a lot.
Yeah.
Does that cause really any harm?
Yeah, so 2 points. क्यों होती है? It's pure physiology. All our joints in the body have fluids. Yeah. और आपको एक मज़ेदार चीज़ बताता हूँ. आजकल आप इंस्टाग्राम पे बहुत सारे वीडियोस देखोगे जो कायरोप्रैक्टर्स के होते हैं, सो कॉल्ड अलाइनर्स ऑफ द बॉडी. बहुत बॉडियाँ चटका रहे हैं.
हाँ.
तो वो एग्जैक्टली वहीं से साउंड आता है.
अच्छा.
तो वो बीमारी का इलाज नहीं हो रहा होता है. हमारे सारे जॉइंट्स के अंदर फ्लूइड होता है, और जब भी फ्लूइड होगा तो बबल्स बनेंगे. आप जब जॉइंट को सडनली एक पोजीशन से चेंज करते हो तो बबल बस्ट होता है तो साउंड आता है, विच इज एब्सोल्युटली नॉर्मल. क्योंकि फ्लूइड है तो साउंड आएगा तो यू विल गेट ग्रेटिफिकेशन आउट ऑफ इट, सो टू से. I've learned this from my psychiatric friends that, it becomes an obsession in some people. So that's wrong. Can't be done. You should try to distract yourself from doing it. People under stress will do that. Long-term impact kya hai? Yes, if you're doing it regularly on continuous basis, you are actually grinding your cartilage every single time you're doing it. Long-term, theoretically, yes, you may damage your joints.
But normally ऐसा मिलता नहीं है.
Yeah, very rare, but you should not do that. And yeah, do not make it your obsession. So yeah, it's good for people who are chiropractors, but not for you, right?
Yeah, another very important thing is, और ये तो युगल, I think it's घर घर की कहानी, height बढ़ानी है, ठीक है? So we started with, I don't want to name the drink, right? हम छोटे थे तो वो एक ब्रांड होता था, वो ब्रांड इससे एसोसिएटेड था, ये पी लोगे तो लंबे हो जाओ, ठीक है? टेस्ट मतलब मुझे तो नहीं आया समझ कर इस चीज़ का, और जिसका आता था उसकी यूएसपी हाइट नहीं थी, ठीक है, पर ठीक है उसकी कुछ और थी, दैट्स आल्सो सॉर्ट ऑफ, दैट्स अनदर डे, बट हाइट, क्या मैं एज अ पेरेंट अपने बच्चे की हाइट पे, अदर देन जेनेटिक्स, अदर देन ऑल ऑफ दैट पार्ट ऑफ द न्यूट्रिशन, कुछ कर सकता हूँ कि बच्चे की हाइट बढ़ जाए?
सो जिस ड्रिंक की आप बात कर रहे हो, तो उसने क्यों बेचा इंडिया में विद द कॉन्सेप्ट की हाइट बढ़ा देंगे? क्योंकि वी आर ऑब्सेस्ड विद इट, राइट? इन माय चाइल्डहुड हम दो चीज़ें देखते थे, मेरे ख्याल से आज भी वो ट्रू हो गया इंडिया में। एक तो रंग गोरा होना चाहिए और हाइट लंबी होनी चाहिए।
और एक बड़े होने पे ना एक और चीज़ रियलाइज हुई मुझे कि बाल होने चाहिए।
बाल होने चाहिए आजकल, ये मैं उस पर आऊँगा ज़रूर, बिल्कुल आई टच दैट पॉइंट टू। सो रंग गोरा चाहिए था तो गोरे करने वाली क्रीम आ गई, हाइट बढ़ानी थी तो हाइट बढ़ाने वाली चीज़ें आ गई। आप कल कुछ और मांगोगे वो भी आ जाएगा। तो बाल उगाने के लिए भी देयर आर लॉट ऑफ,
हाँ भाई, तो अभी तो
मनी इज फ्लरिशिंग। बट कमाल की बात क्या है, थोड़ा भी साइंस में घुस जाओगे ना इसके, आपको पता चलेगा कि वो वही बेच रहे हैं जो आज तक बिक रहा था। जस्ट इट्स अ न्यू पैकेज, एक नया बढ़िया सुंदर पैकेज है, एक फ़ोन पे ऐप है और आप उस पर क्लिक करो और मज़ा आता रहता है। बट एनीवे, कमिंग टू द पॉइंट, हाइट आपकी कितनी होने वाली है आपके बच्चे की, ये आपने डिसाइड की थी जब आपने बच्चा पैदा करने का सोचा था। फॉरगेट अबाउट, वो हो गया था। तो जिस दिन साइंस की बात करते हैं, जिस दिन एग और स्पर्म का मिलन हुआ था, उस दिन डिसाइड हो गया था कि हाइट कितनी होने वाली है बच्चे की। अब वो स्पर्म भी आपका था, एग भी आपके पार्टनर का था, तो हाइट तो वहीं से मिलने वाली है।
बिल्कुल,
तीसरे आदमी की तो आने से रही, राइट? तो हाइट ऑलमोस्ट एन एवरेज आउट होता है पेरेंट्स की हाइट का, उससे थोड़ा कम हो सकता है, उससे थोड़ा ज़्यादा हो सकता है। तो वो तो उसी दिन फिक्स हो गया था, जैसे आपके चेहरे का रंग फिक्स हो गया, जैसे आपका ये डिसाइड हो गया कि बाल कब जाने वाला है। तो इन चीज़ों को चेज़ करने लगोगे आप तो, और फॉर्चुनेटली कुछ इम्पैक्ट नहीं पड़ता, आपकी हाइट कम है या ज़्यादा है। आप सब कुछ कर सकते हो कम हाइट से भी, सचिन तेंदुलकर की तरह। और ज़्यादा हाइट के लोग भी बहुत फेलियर्स मैंने देखे।
इनफैक्ट एक किताब थी उसमें मैंने पढ़ा था, इस दुनिया को ना सादा तक जो उन्होंने इन्फ्लुएंस किया है, दे हैड बीन
शॉर्ट हाइट, yeah, from the worst to the best. Yes. Just what we want to name, but you got the point. All right, so that's not a problem at all. It's already decided. Your genes have decided them, and I think let's not make a point. And I think we should keep impressing upon the fact. हमें रंग की बात, हाइट की बात करना बंद कर देना चाहिए। If you really want to nurture your child, if you really want your child to become more receptive to new things, I mean, ये बातें तो हमें बंद,
ये एट्रीब्यूट्स ही नहीं होने चाहिए,
ये बंद करना पड़ेगा। हमें करना कि लड़की का रंग काला होना चाहिए या गोरा होना चाहिए। अगर हम ये वर्ड्स एलिमिनेट करना शुरू करेंगे अपनी वोकैबुलरी से, तो आवर लाइफ विल बी मच ईजियर।
Yeah, that makes sense. So we discussed almost till mid childhood. Tak again.
Sense, yeah.
I'm gonna enter into Gen Z now.
Yeah.
Okay. और बहुत ही moving vibe है उस generation की, and a lot of memes also keep happening around that. But in its own sense, there's a lot of positives that I hear about this generation, a lot of awareness that guys have.
They're much better than us.
Like एक तो sustainability वाला angle जो इनका, that is worth. The other day actually, I think you only were telling me they have like resorted to eating in steel plates and grandis and all of that, and that's what
they grew up like,
gym is a very strong part of especially, early teenage or, middle teenage. I want to emphasize a little bit on the gym part. किस एज से हम we I know there cannot be a black and white answer to this, but at what age do you think एक बच्चा जिम जा सकता है या जाना चाहिए? Considering the gym is safe, considering it's an environment that's friendly, and all of that, and psychological aspect aside, yeah, और इसके impacts क्या हैं? Both positives and
So yeah, miss, जिम के लिए पहले समझना होगा कि जिम क्यों चाहिए आपको, क्यों, and why would you go to gym and how is it going to help you? When I was young, I went to the gym for the first time after Kaho Na Pyar Hai.
Okay.
Because of Hrithik Roshan. That is what mostly people did. Yeah. Aspiration to become Hrithik Roshan.
Yeah.
Practical, it's not possible because he did that in years, and you wanted to do that on day one. I ended up injuring myself. I came back home, got a bash from my mother, and that's how it was. So we did not have it. You have it. You first need to educate yourself of why do you need gym. Is the gym a place for wellness, for muscle strengthening, to improve your cardiac reserve, or you want to pump muscles? That you have to decide. You have to first find out the category you want to address and what stage of life you are in. Of course, child who is below 18 years of age must not go to gym. Fair and square. And there's no discussion on that. You will end up more injuries than doing good. Better resort to swimming and active sports and outfield sports. Do that.
Okay.
Don't go to the gym.
Right.
Post that age, you can start that. But everything has to be in moderation. You should always listen to your body. You should understand of how muscles work, of how our body work. If you are putting your muscles through unnecessary strain, you will only end up injuring yourself.
Yeah.
Right. And which will, will become a cycle where you have to then stop doing it, and then you will never be motivated to go back again. So better hai that, and यहाँ पे parents का role है. Parents should educate and teach their children, and they themselves can do that, of when is the right time to do it. Is your body strong enough? Are you taking right amount of protein? Are you having right amount of milk? Is your body good enough that it can be introduced to something as training as going to a gym?
Yeah.
Gym means weightlifting. That's what I'm talking about. There are other aspects, and then the newer way of how you can build your muscles. So that's very important. You educate yourself first because you have resources, and then figure it out whether you are the right person, whether it's the right time to start doing gym. So of course, as you said, that there's no straightforward answer to this, but before skeletal maturity, that before 18 years of age, one should refrain from going.
No, yeah. Okay. All right. Like, can young people have arthritis? I mean, it's a very direct.
Yeah.
I mean, I'm obviously not talking about the, the rheumatic and all of that. I'm talking about the, like,
No. Yeah. So in young children and adolescent, the arthritis which can happen are autoimmune disorders. Yeah. Can be juvenile rheumatoid arthritis, which can happen. There are other form of arthritis, but they're all autoimmune or
like, what's the prevalence? Like, common? Like,
no, that's not very common. That's not very common. It's quite uncommon in Indian population. But the arthritis which happens in elderlies, because arthritis per se is a degenerative disease.
Yeah.
It will happen because of wear and tear. Why would wear and tear happen in a younger population? Why a new tire will get worn off? It should drive through a few kilometers to do that. So that's simple logic. So, but then if the child is having symptoms of arthritis, it really needs to be looked very into.
Exactly, Yugal, यही question था मेरा. Basically, I was in a panel discussion recently with a lot of teenagers, and it was happening at a youth festival, and early 20s, I would say. Question was, कुछ एक term है, and I didn't even know it until they told me. It's called old man body pain.
Yeah.
ठीक है. तो ये हमें क्यों हो रहा है?
Right.
I don't know if it's a real term or
Yeah.
a made up term.
No, it's a
ठीक है. So, तो मतलब people in the early 20s are complaining कि यार हमारे body में तो दर्द होता है, हमारे joints में तो दर्द होता है. चलो हो रहा है दर्द, it's fine. But मुझे कैसे पता अब ये वो दर्द है कि मुझे एक ऑर्थोपेडिक को जाके दिखाना चाहिए.
Right. So, दोनों बातों का आंसर दे देता हूँ मैं. एक तो आपको क्यों पेन हो रहा है, उसके 3 सोल्यूशन है, वो कर लो, ठीक हो जाओगे आप. You're not taking milk. 100% you're not taking milk. Or if you're taking it, you're taking in inadequate quantity.
अच्छा.
Milk is so important.
Is it?
Everybody who's saying yes, yes, please. I'll talk to you separately about it. Number one. Number two is that your diet does not have enough amount of protein. I mean, protein intake is crucial for your muscles growth. Calcium is important for your bone growth. Your structure is made of these two things. Number three is activities which involve your muscle stimulation, which can be weightlifting, which can be swimming, which can be badminton, which can be any sports. If you're doing these three things, there's a good chance that you will not fall into this old man's category. But what are the red flags when you need to seek a doctor's help? If you're getting your joints pain, which are specifically in the hands, your hand pains a lot. It is more in the morning when you get up. You feel a lot of stiffness in the joint. The child also complains of back pain, which is again worse in the morning. These are red flags. If this happens, as parents and even as a teenager, should seek help from doctor, because then we are looking into the other possibilities of the arthritic pain.
Right.
The other old man pain can be easily addressed. Just do these three things and you will be all fine.
That is nice. In fact, protein की बात आप कर रहे हो. India as a country has one of the most. Again, it's a nutritional research study that showed we are one of those countries which have the maximum amount of deficit in daily protein.
Yeah. That's for a very simple reason. Our food is very carbohydrate rich.
Yeah, and you know what? आप एक कटोरी दाल लेते हो ना, mentally you are very happy.
And hardly has any protein.
And it hardly has any protein. And अगर जितना है वो भी, the it's not I think I wouldn't say it's a type A protein.
Yeah, it doesn't get absorbed to the extent you wanted. Yeah. So because Indian diet has been majorly carbohydrate rich, and we have been a vegetarian population as a whole, so we do not consume animal protein, which is a direct and a fast source of protein consumption. Those things are now getting changed, and people are focusing more on.
And awareness is coming around the end. And other vegetarian formats of protein is also.
Yes, which are richer in protein.
Absorption is better. Yes. So, with this, I can conclude the childhood part.
Yes.
But, in order to have a good, in order to raise healthier children, we need to be healthier first.
Oh, absolutely. My wife is saying that to me.
Bilkul. In fact, I'll tell you what, I used to weigh 100 kgs, okay? And then I came back to I would say 75, 74. Then I went back to that the seesaw effect happening. Yes. And so it was now this is when I was 93, 94. And I'm सो रहा हूँ मैं, and I get this little bit of chest pain.
Yeah.
Normal था, मुझे पता था ये कुछ वैसा नहीं है, पता है, ठीक है.
Yeah.
And मैं अपने राइट पे देखता हूँ, I see my daughter's student. और मैं उठ जाता हूँ, यार ये तो है गड़बड़ है.
Freaking.
Now I need to change my lifestyle, and I can't do this, है ना. And that's how the reverse thing started. But yes, we got to be healthier there.
Yeah, the message is loud and clear. And before you get the message, you should change your ways you live.
Yeah. I'm going to talk about 3 or 4 very important parts here. This is something that we were talking just a moment back. Muscles. Yeah. Suddenly now, social media is rampant with muscle training, strengthening, and all. When we were growing up, we were doing this, like you said, aesthetically. ठीक है, मेरे को अच्छा दिखना है, मेरे को muscle चाहिए, मैं कर रहा हूँ. But of late, इतनी awareness आ गई, this is the only age reversible organ, this, that, so, which is actually true to a larger extent, I think so. What is your take on it? और अगर मैं अपने muscles को strong रखता हूँ, how does it help me in the older age?
Yeah, so because muscles are like the pillars on which the whole building is standing, right? If your pillars are weak, the building is going to collapse fast. So a good muscle strength will keep your bones healthy, because where do the bones get their blood supply from? From the muscles which are attached to it. That's where they get their nutrition from. So if the muscles are healthy and strong and have a lot of nutrition, they can give it to the bone too.
Yeah.
So that's how the structure will remain healthy. We have seen that in women who pass their menopausal age, that suddenly after menopause, the muscles will become weak. They get a lot of bone pains. I get a call every day. Suddenly the knee pains have come in. It was all fine like 2 years back. The reason is that now the calcium flow out of the bone has started increasing super fast. And your muscles are also weak. So they are not able to provide that support from outside. Because menopause is a physiological phenomena, you can't do anything about it, but you can at least keep your muscles strong. The support system has to be strong. That is how important the muscles are. And if they can be trained well from your adulthood, you will gracefully age. That's what I can.
Yeah. Talking about muscles, I remember. So since we both are from the same medical school, dissection bodies मिलती थी हमारे, है ना? The body that we got for our team, I mean, there used to be one body that we would do it for the entire year, step by step. It was so hard, it was so muscular. वो इतना tough हो जाता था कभी-कभी dissect करना. And out of curiosity, we just wanted to know ये कौन है, क्या है. You remember what then HOD sir? And I think तो भी वही थे उससे. And you're like a legend.
Yeah, he's a legend.
He's a legend. We wanted to know, we asked him, and there was not really, some attendant told us that this was the body of a daily wager.
Yeah.
He was a laborer, and oh my god, what muscles he used to have. And I'm like, ठीक है. But he must have it.
Yeah, the logic is probably. Yeah, logic. See, even if, so assuming that he was a daily wage worker and assuming that he did not have resources to have that amount of good food and nutrition which you have, even then his muscles were strong.
Yeah.
So with all the deficiencies, he was still doing better because he used to train his muscle every day.
In his muscle.
For the perspective for people, we are talking about the cadavers, we are talking about the subject anatomy which is taught in the first year MBBS, so it's not anything gross, and we don't cut people at home. So
no, not at all. Yeah. Okay, so another important thing was with so much advent of work from home कि घर से काम कर लो, companies are giving like 4 out of 5 days just work from home, just come one day. Of course, work from home is not the same environment as office.
Absolutely.
Your postures and everything's going to change. Not everyone has the liberty or luxury to have a proper office space at home. So a bed is most of the cases a bed or a mateship bed is a sort of an office desk. क्या consequences हैं और कितना पड़?
So that is the reason why 70% of my OPD is filled with people who are working from home.
Okay.
So I don't want you to come to me. But the fact is that because the two problems with working from home, there are one, no defined timings. Your body has a biological clock which needs to know when to shut down, when to start again, and work from home has just blurred those lines.
Yeah.
You can start working late in the day, you finish late in the evening.
Yeah.
I just said we do not have resources where one person can make a makeshift arrangement which is as good as the office table, which are ergonomically designed to sit in a proper way. So you end up sitting on the couch or on your bed, as you said, most of the time. And you will be in a bad posture for sure. You will be folding your knees all the time. You will be sitting in a slouched position like this with your laptop at a very bad position. You turn into an ape when you are working. And so as you see, you're not playing video game. You are working and stressful. So you have stress added to your bad posture.
Yeah.
End of the day, you will end up with aches and pain in the neck, in the lower back. You feel your body is all stiff. And you carry forward that to the next day and to the next day.
Cumulative
cycle continues. How can that cycle be broken? One is that you have to correct the way you're doing it. So, agar you are fortunate that you are working from home, from the luxury point of view, now you can do things by your own, times. Try to at least get a good chair to sit on. Try to not sit on bed while you're working. You can make a makeshift arrangement. You can use your dining table as your workstation. You can just elevate the level with some books so that your laptop is at a higher level at the center of your eye. If those small corrections can be done, just put a footstool below your legs so that your hamstrings are not tight when you're sitting all through the day. If you can do that, that cycle can be broken. That inflammation cycle can be broken, and the pains will not become chronic in nature. So that's one advice I have everybody who's working from home.
That's nice. Yeah. I have a question actually. In order to be healthier parents, we need to choose some form of exercise, some form of thing. And I want to address runners here. Okay? There is a club called runner's dad.
Yeah.
ठीक है, and it's a global club and you know it's has chapters everywhere. तो यार ये जो हम भाग रहे हैं, ठीक है, क्या ट्रेडमिल रनिंग वर्सेस आपका नॉर्मल ट्रैक रनिंग, हाउ डू दे डिफर? मैं दो स्पोर्ट्स कवर करना चाहता हूँ. एक रनिंग एज अ थिंग, वी कवर्ड द मसल पार्ट. The second I want to cover is badminton. And the reason I want to cover badminton is क्योंकि suddenly एक pandemic आ गया है badminton का. Everywhere you see court, everywhere you see they're full, and everyone's playing badminton, and for that matter, paddle and other things. ठीक है. So racket sport. So first running and then the racket sport.
Yeah. So treadmill, no treadmill is $1 million question, and I always think that whether it's a healthy thing or it's a health hazard, and so कुछ ना करने से तो कुछ करना बेहतर है. So if you do not have an environment where you can go out and run, treadmill is not a problem. You know what is the problem with the treadmill is when you abuse it, which is true for everything. There are 4-5 things I'll tell you which if you do on treadmill, you will not have the hazard part of the treadmill.
Folks, please.
See, treadmill is a hard surface. If you run on a hard surface, our roads are not hard surface, our grounds are not hard surface. The more hard the surface on which you are running is, more will be the ground reaction forces. Jitna forces zyada honge, utni ankle, knee will get affected. So if you are running on treadmill, number one point is that you should not do that at high speeds. You can low down the speed and increase the elevation. That solves the purpose, right? Number one. Number two, your footwear. Your shoe has to be perfectly tight. Do not wear a worn out shoe. Doesn't matter which brand you're using. It really doesn't matter. Use a footwear which is well tight. Your laces should be perfectly tight and it should not be a worn out shoe. Number three is get proper hydration. So what we call as a cool down warm up, you should always do that. You should do stretching before you start treadmill, finish it off with a cool down, take a lot of water. If you do these things properly, you will only get benefits of using a treadmill.
Okay.
So you cannot say that it is a harmful thing or it's a bad thing. It is, of course, inferior to what you do on an outside running, but in an environment where we live, जहाँ पे pollution भी है और weather extremes के होते हैं, it may not be possible to go out every day. You may do it half of the year, but what about the rest of the year? Go to a place where there is a controlled environment. You can use a treadmill, but then ensure that you have taken these precautions and you will end up only getting the benefits of treadmill. Coming to the badminton part, the newfound interest, I know the reason. The reason is very simple. It's a sport which involves only 2 people. You don't need to have a team like you want for cricket or for football or any sport like that. 2 people are good enough. It's a close court. Again, agonistic to the environment outside, whether it's pollution, raining, it doesn't matter. You can play it any day. Badminton, always play on wooden courts. Wear proper badminton shoes. Do not go and play in your sport running shoes or in your chappals. Please don't do that. You will end up injuring your ankle joint. Most of the time, people come with that. We all ignore the warm-up part. You will start ignoring the warm-up part. You will play badminton only for 15 days. And then you will come to my OPD for treatment and then you'll not go back for 3 months. So if you don't want to come to my OPD space, do warm-ups.
Right. I want to particularly talk about the knees. ठीक है. Is there any link between the ligament injuries around the knee and the badminton?
Yeah, I'm sure
there is.
Absolutely.
So,
absolutely.
क्या suddenly increase हुए इसकी वजह से?
Yeah, I mean, it's actually more common in people who are into professional part of the Isha. It doesn't happen in people who are like into leisure sport. I mean, in those people, we generally get the wear and tear injury. I get a lot of tennis elbows coming after badminton. I get a lot of knee sprains, a lot of ankle sprain. Specifically, ankle twisting injury is very common in badminton. But these are the people who are actually into professional sport who end up with a ACL injury while playing badminton because, they really play it hard. The smashes they do, the heights they gain, and those times the injuries can happen. So we have seen a slow rise in the cases of sports injuries. In badminton, again, the another common injury are the shoulder injuries because the amount of forces we're using from your shoulder. That's why all the training are focused on how much the forearm should be involved, how much the arm should be involved while you're taking your shots, and the sports physios do focus on that. But these injuries are very common. The shoulder injuries and the ACL injuries around the knee are very common in people who are into professional sports.
Right. So, walking as an activity, as an exercise, how good is that?
So that's the point. So I think walking is being sold by the smartwatches.
Yeah.
It's had
The pedometer,
yes, yeah, the step counter has become our new obsession. There's no harm in that.
Yeah.
We just need to understand that what are we trying to gain from it. So what I tell people is that, see, if you're old, if you have crossed your 60s, 70s, and in majority of people who have a bad knee and a heart which had undergone some treatment, running is a bad idea, treadmills is a bad idea, active sports is a bad idea. What are you left with? You should walk. You should walk. But come you're 40 years, you are fully active, or 60 and you're fully active, then walking is not going to help. You walk 10 kilometers and it's going to be the same. But you run 1 kilometer, it'll change everything. So either do brisk walk, which even WHO says that if you're really wanting to change your cardiac health, it has to be a brisk walk, which increases your heart rate. If your heart rate is not increasing, it's pointless. You're just wasting your energy. And brisk walk to running. I mean, that is what is going to help.
Yeah, that makes sense.
Counting steps is not going to help.
Yeah. So, the first segment of this show was pregnancy.
Yeah.
And there's just a couple of questions.
Yeah.
Probably actually one or two, to be honest. The back pain during pregnancy. Just talk about it. Yeah. क्यों हो रहा है?
Right.
And क्या आपकी तरफ से, do you think there are things that we can do to avoid?
So I'll tell all the females who are planning to get pregnant and in pregnancy and post pregnancy, tips and tricks. So one is that during pregnancy it will happen because your physiology is changing, the body is preparing to deliver. All the muscles will get relaxed, all the ligaments will get relaxed, so that your uterus finds space for your the baby which is getting inside, growing inside, and preparing your uterus to deliver.
Yeah.
So that is the physiological change. Mechanical change which is happening is because of the child inside, your weight is increasing and the center of gravity is shifting forward.
Okay.
Right? Because the tummy is growing, the center of gravity will shift forward. That will put a lot of strain on the back. So that is the mechanical reason. The chemical reason is that in that duration, your irons will come down, your calcium requirement will increase, your vitamin D requirement will increase. So in सब में से क्या fix कर सकते हैं? Your supplementation has to be perfect, and most of the gynecologists will prescribe that. You should take your regular calciums, you'll take regular vitamins, magnesium, they're very, very helpful. Iron, folic acid, extremely important, right? Very much guided rehabilitation or antenatal care exercises are important, but they should be done under guidance. Of course, you should not venture into watching YouTube videos.
Not at all. And every case is very specific.
Your gynecologist should tell you if you should do it or not. Of course, she will not know what to do, but she'll at least tell you when to do, right? And every trimester is different. The requirements are different. What kind of pelvic exercises, what kind of back exercises. So that has to be done under the guidance of the antenatal physiotherapist and your gynecologist in that particular scenario. That's the caveat. Post-pregnancy, if you have undergone a cesarean section, wait for first 1 month. We generally do not prescribe exercises to be started because your uterus is healing, your body is healing through it. After you crossed 1 month, because you're investing so much of time with your child, feeding the child, you're sitting in a bad posture, your sleep is gone for a toss. After 1 month, you have to really start focusing on getting that strength back. And it has to be started from pelvic strengthening and core strengthening.
Okay.
Only 2 exercises. If you do them right, in guidance, without guidance, if you're good at it, you can do it yourself. That fixes problems for the future, right? And supplementation. I keep pushing people that take milk, take calcium, take vitamin D supplement at least for first 3 to 6 months. It's very important so that your body recovers out of that pregnancy. Pregnancy was a special phenomena which has happened. Maybe will not repeat itself again. But your body has to go back to normal. These things have to be done. And if you do that right, you will not feel the impact of it after say 5 years, 10 years.
And also the supplements don't just go over the counter and
No, they're not going to help you. If you're going over the counter, you will either end up with the wrong molecule or wrong.
yes, it's better to get them prescribed by your doctor.
Absolutely.
Yeah. Perfect. So, I think we have just covered all the things. Is there, like this 2026, a message to our viewers from an orthopedician, what it should be to every viewer, like mainly their parents?
Yeah, I think there's an interesting thing happening in 26, and you may not know about it. So there is something called as a sunshine paradox.
Okay.
So India is a country rich in sunshine. We are very close to equator, and we have a lot of sunshine. बट उसके बाद भी हमें जोड़ों के दर्द हो रहे हैं, विटामिन डी की डेफिशिएंसी हो रही है. प्रॉब्लम क्या है? इतनी सारी धूप है लेकिन विटामिन डी नहीं है. बिकॉज ऑफ द अर्बनाइजेशन, बिल्डिंग्स बड़ी हो रही हैं, आप घर के अंदर रहते हैं, तो विटामिन डी तो आएगा नहीं. विटामिन डी आएगा नहीं तो कैल्शियम जाएगा नहीं. तो विटामिन डी बेसिकली कॉन्सेप्ट इज, विटामिन डी जब बॉडी में होता है तो कैल्शियम ब्लड से बोन में अब्जॉर्ब होता है. अगर विटामिन डी नहीं होगा, डिलीवरी पार्टनर नहीं होगा, तो खाना आपके घर पहुंचेगा नहीं. दैट्स हाउ इट वर्क्स. सो इट्स ऑलमोस्ट गोइंग टू बी ए साइलेंट एपिडेमिक ऑफ 26 and going forward. Vitamin D deficiency leads to less absorption of calcium, increasing problems with the joint pain. So my message is very clear that vitamin D resources are very limited, and that's why supplementing is important. But it should not be done over the counter. You should always seek help, get your levels checked, whether you really need it or not, or there's something else which is the reason for your pain. The myths around the consumption of milk should be busted. We should talk more about it. It has always been helpful. It is one of the most powerful food which is available, and I'll keep selling it till everybody buys it. You can take your call of what kind of milk you want to have, but it is important. If you do these things right, probably you will not be part of this epidemic. If you want to stay healthy and keep your bones stronger and still want to live in Delhi, I mean, you really need to work on these.
That actually is a great one. I want to actually just put a line out here. Do not just go to the counter and pick up vitamin D, because I have seen cases. I've seen cases with hypervitamin toxicity, also very common. And vitamin D toxicity is bad.
It will have the same impact like the deficiency. So, I mean, it's always good to get yourself tested.
Right.
I mean, and seek guidance. I mean, take it from the help.
Absolutely. I mean, it's simple. Go to a practitioner.
Just take a consultation, and you will. He'll tell you what you have to do for next 2 years.
Get a test,
and it's not expensive. It's not consult, and you're good for 2 years, and you don't need to do it.
Absolutely. Thank you so much.
Thank you for invitation.
आज के एपिसोड में हमने प्रेगनेंसी से लेकर बच्चों, टीनेजर्स, जेनजी और पेरेंट्स तक के ऑर्थोपेडिक कंसर्न्स को डिटेल में समझा. उम्मीद है आपको अपने सवालों के क्लियर, प्रैक्टिकल आंसर्स मिले होंगे, जो सिर्फ दर्द नहीं, फ्यूचर प्रॉब्लम्स को भी प्रिवेंट करने में मदद करें. मैं हूं डॉक्टर गौरव निगम, और मैं दिल से थैंक यू कहना चाहता हूं डॉक्टर युगल का, जो इतनी वैल्यूएबल इनसाइट्स हमारे साथ शेयर करने के लिए आए. अगर आपको ये एपिसोड हेल्पफुल लगा हो तो लाइक, शेयर और कमेंट जरूर करें, ताकि ये इंफॉर्मेशन और लोगों तक पहुंच सके. और ऐसे ही एक्सपर्ट कॉन्वर्सेशंस के लिए डॉक्टर डैड पॉडकास्ट को सब्सक्राइब करना ना भूलें. मिलते हैं नेक्स्ट एपिसोड में. तब तक टेक केयर ऑफ योर बोन्स, पॉस्चर और हेल्थ.